name is Jolene Peters. I am the manager of the emergency department at Hamilton General Hospital. I'm going to quickly explain to you my business plan on how to manage the increase of volume within the emergency department with minimal impact on resources. I'm going to explain what the problem is in a short summary. So, due to recent closure of an after-hours clinic over the past 6 months, the number of emergency visits have increased from 120 patients per day to 140 patients per day. That's a 16% increase. The growth has occurred with patients with C-test levels in 4 and 5, and patients with C-test levels 1 to 3 have remained the same. There hasn't been any change with that one. In light of this, we've experienced increased wait times and increased costs towards overtime for additional personnel to compensate for the overflow. So I'm just going to explain CTAS, the CTAS acuity scale for you. It's called the Canadian Triage and Acuity to accurately define patient needs for care and allow the physicians to evaluate their acuity levels, resource needs, and performance against certain objectives. How it ranges from levels 1 to 5, level 1 representing the highest level of severity and level 5 representing the lowest level of severity to more non-urgent patients. So as the manager of the emergency department, I would like to present my strategy to manage the increased volume in my department with minimal use of resources. So I have a few goals in mind. My first goal is to decrease patient volume in the ER by providing better patient education on emergency room alternatives such as the urgent care center, walk-in clinics, telehealth, stuff like that, or even their family doctor. I also have an idea to implement a self-serve assessment kiosk for non-critical patients after they've been triaged by the nurse. Once the triage nurse has assessed them and gave them the C-test level 4 or 5, they will do what they can as minimally as they can, and then the patient can then move on to the self-serve kiosk where they can put more information in, such as medications, allergies, how long that they've had their chief complaint for, the level of distress they're in, anything like that, any sort of information that will help the physician better assess them when they go see them in the emergency room. I'd also like to review the standardization of care for patients in C-test levels 4 and 5. I feel that maybe the standardization for those certain diagnoses have been unchanged for quite a while, and maybe they just need to be reviewed again to see if we can make them more effective or efficient. The next one would be faster discharge of patients, so more beds become available and free up space in the ER. I feel that there's certain patients that have been admitted just for monitoring or low acuity diagnoses, and they're staying in and occupying beds for much longer than they need to. I feel that that time should be cut down to 12 to 24 hours after they've been monitored and a treatment plan has been being put in course, and then they can move on to a longer term of care, such as like long-term care, follow up with a specialist, anything like that. The last thing that I would like to do is implement a quality improvement plan. So after I put in a few of these strategies in place, I like to see how well they're working, if at all, or ways we can improve them. Maybe they are working, and over the year, say I want to do it for 12 months, we'll see how that after that year, how if the quality has improved and what we can do to make it better if it doesn't. Okay, so there are some financial, non-financial investments that I'd like to. I kind of came up with just a number around $50,000 to create, supply, and distribute better access of information from to and from our patients. So, such as providing and creating pamphlets regarding alternative care, like I said, UCC, telehealth, walk-in clinics, etc. Public advertising through television or billboards. I have seen them around in the Hamilton area, so I assume it's effective. Upgrades on outdated websites that become more user-friendly and mobile-supported, so people can just go on their phones and look things up really quickly. ER time, wait times, stuff like that. I'd also, again, with the rapid assessment kiosk, I'd like to put some money into that. At least having one kiosk for a person to, maybe there's 15 to 20 people waiting in an ER. At least if they filled out that kiosk, their information can flow a lot easier. I'd like to put money into that. I'd also like to put some non-financial investment into research and education of our community. I'd like to get qualified personnel to donate some of their time to educate the people in their community with maybe a monthly accessible meeting that they can go to the hospital. They can have like a lunch, maybe a 1 hour session, and the physician or nurses or social workers can explain the alternatives that are available to them instead of always just going to the emergency room as their first option. I'd also like to have some research staff to go over the standardization of care with patients in C-test levels 4 and 5 to see if we can make it a little bit more efficient, maybe shorter, but the quality is still there. I'd also like to look into quicker discharge of patients being admitted for monitoring or low acuity diagnoses, as I mentioned before. I feel that for the non-financial aspect, I can get them to provide their time by providing like by financial incentive, I guess you can say, more like recognition. Maybe that will strive them to help out and help their community. I have a timeline for this. I suggested giving 1 year to have this whole, from about 6 months to 1 year to have this whole thing come into effect. As soon as you give me the go to do this plan, as soon as that goes, I'm going to create a team. I'm going to lead the team. I'm going to issue the strategy that I have, pick the people that I want to implement that strategy, and go from there. Once I have implemented the strategy and I've created my team, I'm hoping that after 1 month, I'll be able to have a plan. Everything is going, and one goal to the next goal to the next goal, and hopefully after that 1 year has passed, I can then look at my quality improvement plan to see if this has improved or not. There are some risks involved, with anything. The risks of patient education are some people just don't want to learn, or they ignore the information that's available to them, so it just becomes ineffective. I think as long as it goes through the right channels and is presented and put out there well enough, then maybe people will want to listen. There is also a lot of people with English as a second language, or the elderly. They're not very inclined with the internet, or some patients just don't understand, and all they know is, let's go to the ER. I know I'm going to get help there, so they don't know what else to do. So that would be one of the risks as well. Investing money into a self-serve kiosk will obviously have ongoing operating costs, necessary training, system integration, and it could also risk effectiveness and efficiency, especially because it's unknown. So this possibly could be a trial in one of our hospitals to see if it will work, and we'll go from there. And if it does work and it does increase quality and improvement, then we can implement it in more hospitals. Having qualified and trained personnel donate their time to do research and provide education may find themselves a little bit tired from having to do that, having to balance patient care, education. It could affect both the physician and the patient, so they need to find a balance between the two. So that could be another risk. If we do nothing about having increased volume in our emergency department, we'll just keep wasting money on overtime. Our physicians will become overworked. ER wait times will continuously exceed the Ontario requirements that we should be setting our standards to. Patient care will lack, the hospital will lose accountability, and we'll lose respect from the community, and that's not something we want. So I hope that you take a look at my business plan and let me know how it is. I do hope that you give me some insight of how, if I did this okay or not, and I appreciate your feedback. Okay, thanks. Bye.